There is a phone number on your hospital bill, and there is another number they do not put on it. Most people call the first one. They read their balance, feel that cold weight in their chest, and start asking about a payment plan. That is exactly what the billing department is trained to help you do: pay. What almost nobody does, and what the hospital will not volunteer, is call to ask whether that balance should be smaller, or whether it should exist at all. This is not a loophole. This is not a trick. It's a legal requirement that nonprofit hospitals across the country are obligated to offer, and they are counting on you not knowing it. Most of them never mention it unprompted. The IRS classifies most major hospitals in America as 501c3 nonprofit organizations. That status comes with a condition. Under federal rules introduced in 2010 and finalized in 2015, known as the 501R regulations, every nonprofit hospital is legally required to have a written financial assistance policy. They must make that policy publicly available. They must apply it to patients who qualify, and they must, by law, limit what they charge those patients. The problem is not that the program doesn't exist. The problem is that the hospital has no financial incentive to tell you about it. Here is what that program actually looks like. The formal name varies: charity care, financial assistance, sliding scale discount, hardship reduction. The name on the form is less important than the number attached to it. Most people assume these programs are for people in extreme poverty. That assumption is wrong, and it's costing households real money. A 2023 analysis by KFF Health News found that hospitals frequently set their financial assistance thresholds at 200%, 300%, or even 400% of the federal poverty level. For a single person, 400% of the federal poverty level in 2024 is roughly $60,240. For a family of four, that threshold sits near $124,800. Read that again. A family earning $90,000 a year can qualify for hospital charity care at many institutions. And that's before the itemized bill review, which is a separate process entirely and one that matters just as much. A study published in the journal Health Affairs estimated that billing errors appear in as many as 80% of hospital bills. Incorrect procedure codes, duplicate charges, services billed at the wrong rate, a charge for a semi-private room when the patient was alone. These are not rare anomalies. They are a structural feature of a billing system that processes enormous volumes of claims with minimal external review unless the patient asks for one. Here's what I want to know. If you have ever received a hospital bill and just paid it, drop the amount in the comments. No names, no details, just the number. I want to see how much this gap in information has actually cost people watching this video. And here's what connects the itemized bill to the charity care application, because most people treat them as separate conversations. They are not. When you call the billing department and request an itemized bill, you are not just checking for errors. You are also beginning a documented record of engagement with your account. Hospitals track patient contact. A patient who has called, requested documentation, and is clearly informed about their rights is a patient the billing department treats differently, not out of goodwill, out of process. The charity care application is the next step in that same process, and the two together produce better outcomes than either one alone. The math was always going to land here. So here's the sequence. 3 calls. That's all this takes. Call 1, request the itemized bill. This is your legal right under federal law. You are entitled to a line-by-line breakdown of every charge on your account. Ask for it in writing. Ask for it to be mailed or emailed. Do not accept a summary. The itemized bill is the document you need for everything that follows. Call 2, ask for the financial assistance application, not the payment plan department, not billing, not collections. Ask specifically for financial assistance or charity care. If the person who answers doesn't know what you're referring to, ask to be transferred to patient financial services. The written financial assistance policy is a public document. You can also find it on the hospital's website or request it directly. Fill out the application, submit it. The income thresholds, as covered earlier, are likely higher than you think. But here's the thing. Those 2 calls cover most situations. There's a third call that covers the rest. If your balance is large, if your situation is genuinely hardship level, or if you've already been sent to collections, this third call is the one that changes the outcome. Call 3 is to a hospital patient advocate, or in more complex cases, a medical billing advocate. Patient advocates are employed by the hospital and are specifically tasked with helping patients navigate the financial assistance process. They have authority that the standard billing department does not. Medical billing advocates, independent professionals who work for the patient, not the hospital, typically work on contingency, meaning they take a percentage of what they recover. The National Association of Healthcare Advocacy and the Alliance of Professional Health Advocates both maintain directories of credentialed advocates. If you know someone who has a hospital bill sitting on their kitchen table right now, this is the video to send them. The sequence takes less than an hour. The outcome can be a balance reduction that a payment plan would never have addressed. One more thing before the charge amount becomes a fixed number in your mind. Hospitals have 2 prices: the chargemaster rate, the full listed price which almost no insured patient pays, and the negotiated rate, what insurance companies pay, which is typically 30 to 60% lower. But uninsured patients and patients with high deductible plans are frequently billed at rates closer to the chargemaster rate. The 501(r) rules cap what nonprofit hospitals can charge financial assistance recipients. They cannot charge more than the amounts generally billed to insured patients, which means qualifying for financial assistance doesn't just reduce your bill, it can legally reset the price to a rate closer to what an insurer would have paid. That distinction, and the number it produces, is why the call matters before the payment. So here's where to start. Go to the hospital's website. Search Financial Assistance Policy or Charity Care. Download the document, read the income threshold. If your household income falls below it, or even if you're not sure, call the number for Patient Financial Services and ask for the financial assistance application. Then call back and request the itemized bill. Cross-reference every line. If anything looks wrong, and statistically something probably is, flag it in writing before the account moves anywhere near collections. The number you're calling is not hidden. It's just the one they're not trained to offer you first. Most people never call it at all. You now know to call it before anything else. If you want to understand why your bill was inflated before you even picked up the phone, the next video covers exactly that. It's called Why Your Hospital Bill is Already Wrong Before You Pay It. Watch that one next. What question do you have about your hospital bill right now? Drop it in the comments. I read them.